Hi, I'm Julie DeRose, and I'm a psychologist and owner of Open Door Psychology. I wanted to make a quick video about some frequently asked questions about therapy and going for counseling. So, question number one, what is counseling all about? What is therapy all about? Well, the best answer I can give is it is an opportunity for you to come and talk about things that you want to talk about. The therapist isn't going to force you to talk about anything. They're going to ask you questions, of course, but you have the right to say, no, that's something I don't want to explore right now, or answer them. Now, the best thing to do when you are going through therapy is to be as honest and open as possible, because the more honest and open you are, then your therapist is going to be able to support you the best way. Question number two, what type of approaches do therapists use? So there's many different approaches out there. I'm sure some of you have heard of cognitive behavioral therapy, CBT, or dialectical behavioral therapy, DPT. There's also solution focused. There is humanism. There's many different therapeutic approaches, and depending on the therapist, they may lean towards one or do something called integrative. I usually use an integrative approach when it comes to counseling, because I feel like depending on the client and what they're presenting with, you might use a mix of things, maybe some narrative therapy or some cognitive behavioral therapy, especially when there are thought processes that are not all that helpful to the individual. And I'll do one more question. So, frequently asked question number 3. What should I bring when I go to therapy? You know what? Nothing. When you come to therapy, typically before you arrive, you'll have to do an informed consent. Lately, a lot of them are online, so you write it in. Basically, what you're doing is agreeing to the terms of therapy, confidentiality, and then this is always gone through when you go to your first session, and ongoing as well. So make sure you either bring that form or that you have submitted it. And then you want to ask about benefits or ask about insurance, whether or not your session is covered at all through your benefits. So those are things obviously not to bring, but things to consider in terms of your first session and the things that you need to know. So I hope that was a helpful video, and I'll do a second part next week. Take care, everyone. Bye.